Person experiences any kind of physical or mental trauma. Its effects on those it plagues, though, are sometimes complex, leaving sufferers with a severe sense of helplessness. We talked to an expert today, Dr. Seidel, lecturing to mental health professionals in Roanoke.
One is that the person tends to re-experience the event, like a videotape keeps playing in their head, or they have nightmares about the event. The second category has to do with avoidance symptoms, and that tends to be people who pull away from other people or things that might remind them of the event.
Another symptom is hypervigilance, as the patient may startle easily and become more irritable. PTSD is frequently accompanied by other conditions like substance abuse and depression. While the name post-traumatic stress disorder has only been in use since the early 80s, the disorder has been around for quite some time, dating back to the Civil War.
In World War I, they talked about shell shock, battle fatigue. Those things are probably more familiar to folks. What people may not be aware of is a diagnosis called railway spine that came about between the two world wars. And that resulted from railroad workers who, in their work environment, experienced a variety of stressors that could be considered traumatic, and they were coming up with the kinds of symptoms I described earlier.
So while PTSD is common in war veterans, it can also affect anyone who has felt or been physically threatened or witnessed a loved one in that situation. As children may also be victims of trauma, Dr. Seidel says professionals must reach them early.
Giving people the opportunity to process, to express unexpressed feelings, to talk about how they've made sense of that event is very, very important and can, in fact, help eliminate or decrease the incidence of post-traumatic stress disorder for a number of people.
Treatments for PTSD often involve extensive inpatient, group, and individual therapy sessions. At the same time, medications like Prozac or other antidepressants may be used. And Dr. Seidel says that while the Veterans Administration had really been criticized for its handling of PTSD, the VA has really been in the forefront of treatment programs ever since the early 70s.
Okay, that's good to know. All right, thanks, Connie. Well, let's check in now with Roy Stanley for today's 2-minute sports ticker with some stories.
Why do some people suffer from depression over the holidays, and what can be done to combat it? To answer these questions, we've brought in Rick Seidel, who is the Director of Psychiatric Services for Roanoke Memorial Hospital. Thank you very much for being here with us today. I guess my first question is, why do people tend to get the holiday blues around this time of year?
Well, the holidays are a very stressful time for a lot of people for a number of reasons. Some things as simple as the amount of time that we have to dedicate to doing so many different activities, such as preparing for meals, preparing for guests, having friends over or family members visiting and so on. Those are stressful events, as well as just the shopping and all the other things that go into preparing for the holidays. So that's one type of thing that is very stressful and can get people down. Additionally, things like financial strains. You may not be able to purchase the kinds of things you want for your children or loved ones or whomever. And additionally, there are problems for folks who may not have someone there that they had in the past.
What makes you more susceptible to holiday blues?
Well, I think that one of the things that makes people have more difficulty is not having some social support, not having connections with another person. And that's why people who have lost someone recently are particularly vulnerable to this kind of distress.
How do you beat them? How do you avoid them?
Well, I think that to find some way to be connected to other people, whether it's friends or a volunteer organization of some sort, to be able to form those links is important. To have realistic expectations about what can be accomplished, what you can do during the holidays, to plan your time, and to set aside some time for yourself, because sometimes we get so caught up in doing things for our children and our families that we forget that we need to take some time out and kind of regroup ourselves as well.
Dr. Seidel, thank you very much for joining us today. Quick look at the holiday blues. Now, Robin, what can I understand we've got nasty weather. Maybe if I win the $24 million, we won't have to worry about that.
Maybe.
West Virginia are abusing OxyContin and about how people benefit from it in our area. One of our local hospitals right now is a local hospital in our area is researching the OxyContin abuse problem we have in our area, hoping to find some much-needed answers.
Many people are tired of hearing about OxyContin abuse, but ignoring it will not make the problem go away.
I think it's only fair to point out that addiction did not start with OxyContin. And so for people who are tired of hearing about it, I can understand that.
Dr. Rick Seidel is involved with a local study at Carilion to try to find ways to treat specific problems in our area.
How many points is that?
6 points.
William Rose is one person who was addicted to OxyContin. He got clean through a local religious program, Teen Challenge. Clean. People may be tired of hearing about it, but the abuse is growing.
The reality of it is that we need to address it. If we don't do something to take care of it, it's only going to get worse.
And if it gets worse, local pain patients like Jeanette Murray fear the drug may one day be pulled. She needs it to control nerve pain that is so severe the touch of this tissue causes her excruciating pain. Dr. Seidel, along with others, is hoping this local study will answer these questions.
How do we treat addiction? How do we help people who have this kind of illness? And how can we do it, and particularly, how can we do it effectively?
A question many people have been asking for a long time now, especially regarding the OxyContin abuse. Now, Carillion's Behavioral Health Department is expecting to have those results within the next 2 weeks. We'll be sure to keep you updated, especially since they do target the specific problems going on in Southwest Virginia. Live in the newsroom, Karen McNew for Health Team 10.
Who've had trouble with OxyContin in the past.
What we were focused on is treatment, because our concern is for our patients and the people in our community.
Carilion is having meetings with the New River Health District to find practical ways to implement suggestions.
Well, teachers heading back to school will have a new benefit this fall.
Leanne, that one of the main suggestions that might help people deal with these feelings of stress and this overwhelming emotional feelings that we're having is to talk about it with people, whether it's family or friends, just to get it out in the open, sort of get it off your chest. I did talk today with a local psychologist who specializes in trauma treatment. His name is Dr. Rick Seidel.
To be nervous, to be replaying the images on the television of seeing the plane go into the tower and so on for a period of time and be a bit troubled by that is a normal human reaction to this level of stress. It's important for folks as we go through this as a nation, in my opinion, you don't hole up in your house with your 45. You need to be involved in your daily activities, use friends and family for support if you're feeling unsettled, but do the things that you do day to day. People in the news reports and things have been likening this or trying to say Pearl Harbor, the assassination of JFK, and those are events that impacted the nation as a whole. They were unexpected and sudden. Pearl Harbor, however, at least we had an identified aggressor, and we could go after that aggressor and channel some of those energies we were just speaking about.
And it seems now we may have an identified aggressor as new reports keep coming in. Of course, we'll bring that information to you, but that would at least give people somewhere to channel those aggressive feelings, is what Dr. Seidel was saying. Now, he also said, don't be ashamed. If someone is so upset that they just can't function with their daily life, then they should not be ashamed or embarrassed to contact someone who can help them professionally. And speaking of that, the New River Valley Community Services is offering free counseling for people who want to speak with staff. You can call the number you see on your screen, 540-961-8400. That's in the New River Valley, or toll free, 1-888-717-3333. Live in the newsroom, Karen McNew for Health Team 10.
Clue that may help explain some cases of infertility in men. Mayo Clinic researchers found mice that lacked a certain protein in their sperm were infertile. The researchers say the finding could help lead to a screening test. A new study sheds light on just how stressed Americans are from the September 11th attacks. 90% of those surveyed reported one symptom at least a little bit. Another 44% had at least one symptom quite a bit or extremely. The most common symptom was feeling upset when reminded of the attacks. Anthrax threats have also increased anxiety. A local doctor gives 5 ways to fight the fear factor. Get information. Don't isolate yourself. Give your life meaning. It does take time to heal, and limit your media exposure to terrorism news. And nicotine lollipops may help you with smoking habit. Each one's designed to satisfy the urge to have a cigarette. The lollipops have to be specially made. You do need a prescription. You could call Blue Ridge Apothecary in Roanoke, also Down Home Pharmacy in Botetourt, 2 places that can make the lollipops. Again, you do need a prescription. Karen McNew for Health Team 10.
And there's very good research in the literature to show that how we feel about things, how we think about and how we behave in response to our physical condition has a dramatic effect on how we do.
That's why he says the workshop, Living Well with Chronic Health Problems, has been so successful.
The research shows that they go to the doctor less frequently, that their quality of life is better, their functional status is better.
The workshop includes a variety of topics, including managing medications, dealing with depression, eating well, pain control, fighting fatigue and frustration, and how to start an exercise program. Rayburn says it was the push he needed to get him headed in the right direction.
Okay, my turn. I learned about some exercises that's easy to do, and it would get my endurance built back up. And I also learned to adjust my attitude to where I become reconciled to my condition.
Now he's enjoying life with his grandson and taking his condition one day at a time.
You just have to motivate yourself to live in your new life.
The workshop is about the attacks that you watch. That is especially important for children.
You don't want to ignore it, but you don't want to be spending hour after hour in front of the television having those images replayed for you. I don't think that would be very useful.
Seidel says the one-year anniversary of any tragic event or death is often the most difficult.
When you come back around to that first anniversary, a lot of things trigger the memories. People are talking about it. There are things in this case that are going to be in the media, for example, that are going to trigger memories, and with those memories are going to come thoughts and feelings.
Seidel says talking about those feelings and what happened and why is an important step in the healing process. He also recommends taking time to honor those who lost their lives and to appreciate your family and friends.